Hello, Squawks and family. This is Marvin. I wanted to take a few minutes today and talk a little bit about the vaccine, the COVID vaccine that many of you have seen in the headlines in the last week or two. Um, really wanted to discuss what the path for the Squaxin community is for our people, kind of the teamwork going in behind it, and the way forward. So first, I would just tell you that the vaccine that you saw approved last week, the Pfizer vaccine, is one that the tribe will not be receiving. There are many reasons that go into that decision. Some of those have to deal with storage temperature and some sensitivities that are associated with that vaccine. The tribe will be pursuing and receiving the Moderna vaccine that you should see approval on by the end of this week. We are receiving our vaccines from Indian Health Services, and we have been notified that we would be receiving 100 doses of the vaccine by the end of December, possibly the first week of January. So please pay attention to the Moderna one and not so much the specifics of the Pfizer one. Now, how would we deploy it? Who would be first? Um, we have a team that is doing a great job, a team that consists of people from the health clinic, Emergency Operations Center. Tammy from enrollment is helping out. We have a couple of people from the casino. Ricky Ramage and her team are helping out. It's just been great to see a group come together for a specific reason to care for our people. This team has come up with a plan that will be executed down at the event center. So when vaccines are available and you are notified, they're going to take place at the event center of the casino. Leadership has approved the following order for priority of who would receive the vaccine first. The first priority is going to go to healthcare workers, first responders, and our elders. So that first 100 doses will take care of a good chunk of our elders and obviously the whole health clinic. The next tier, or the second group, and potentially the second doses that we receive, will be opened up for primarily people. We'll finish getting the elders that we may not get. We'll also open it up to people with compromised immune systems, and then it'll go to community members, tribal members, descendants, spouses, people within this community. And we've also requested enough doses to cover our staff and our employees. So there's a big plan. That's the priority that's going into it. Um, we are going to have a question and answer video tomorrow with some of our medical assistants that will cover specifics. I just wanted to get out some of the common questions, some general information, so that way we can answer some of your questions. Also, just so you're aware, the Moderna vaccine is approved for adults, so people 18 years and older. Right now, the vaccines, neither the Pfizer or the Moderna vaccines, approved for children. So just keep that in mind. The next thing I wanted to talk about is where we're at or how we're going to go forward. So we've said from the beginning, and I've mentioned it to you guys a few times, that this is a marathon, and I would just caution that as you see vaccines approved, or even see it in our community where they're starting to be um, deployed and we're inoculating people, that isn't the finish line. And so I just want everybody to be cautious. This is a vaccine approval is a step in the right direction, and it's where we need to get to. But it, by all means, can we let up what we've already done? There's a ton of people that have sacrificed a lot. There's elders, there are people in this community who've stayed home. There are people who've worked tirelessly to make sure we have policies in place to protect our people, that have deployed IS assets so that we could have people still work from home and provide our community with the things that they need. There's just so much effort that's gone into this that I caution that this word of vaccine makes people let up. So please, I implore you to continue to practice the social distancing. I ask you to continue to wear a mask, and just all the things that we've done to get to this point. We ask that you keep doing. Keep thinking of your neighbor. Keep thinking of the people around you, and not what's best for you, but maybe what's best for the people around us. That's what's gotten us to this point. We've been very successful at keeping this from spreading throughout our community. The isolated cases have not spread, and it's just been a blessing. And it's been great to see our community pull together. It's been great to see our team work together for solutions. And so I just ask that we continue that path as you start to see this vaccine stuff roll out. Again, I just want to remind you, tomorrow you should see a question and answer with some of our medical folks that will provide more specific questions. I do ask one last thing before I sign off here. Please have some grace and patience with the health clinic. Not only are they seeing current patients and people that have appointments, but they're also formulating this plan behind the scenes. And so as this vaccine becomes available, those are the professionals that are going to be down there in the health clinic or in the event center providing this service for you. And so if you end up with having to reschedule an appointment or an appointment that isn't made because the doctor's down there providing these vaccines, I just ask for your patience in this time and just your understanding. It's been great just to see our people pull together. Let's continue this and let's just finish strong. Thank you.